Hello again and welcome. This is part 5 of a series on UPSC. In the last 4 videos, we talked about chemo, immunotherapy, radiation, hormonal therapy, IHC and FISH testing, resources for information on clinical trials, a support group, and patient guidelines for treatment. In this video, I would like to talk briefly about a chemo port, clinical trial phases, and genetic testing. I have a chemo port called a power port. A chemo port is a small implantable reservoir with a thin silicone tube that attaches to a vein. The main advantage of this vein access device is that chemotherapy medications can be delivered directly into the port rather than a vein, eliminating the need for needle sticks. Many people who receive chemotherapy choose to have a port implanted if recommended by their treatment team. A chemo port is placed under the skin near a large vein in the upper chest. This can be a good alternative to an IV catheter that is placed in an arm or hand vein, as a suitable IV site can sometimes be difficult to find. Easily accessible by a patient's treatment team, a port can provide a safer and more efficient medication delivery process than an IV. And while a port will produce a quarter-sized bump under the skin, it can be easily covered with regular clothing. Regarding clinical trials, I wanted to mention that there are different phases that you can enter. You will see what phase the trial is in when you do your research on clinicaltrials.gov. I will give a brief description of each one here. A Phase 1 clinical trial focuses on the safety of a drug. They are usually conducted with healthy volunteers, and the goal is to determine the drug's most frequent and serious adverse events, and often how the drug is broken down and excreted by the body. These trials usually involve a small number of participants. Phase 2 are clinical trials that gather data on whether a drug works in people who have a certain condition or disease. Participants receiving the drug may be compared to similar participants receiving a different treatment, usually an inactive substance called a placebo, or a different drug. Safety continues to be evaluated, and short-term adverse events are studied. A Phase 3 trial gathers more information about a drug's safety and effectiveness by studying different populations and different dosages, and by using the drug in combination with other drugs. These studies typically involve more participants. I was in a clinical trial for a short period of time, and basically all I had to do was fill out some paperwork, later show up at the hospital where they drew blood, and then receive the infusion. Unfortunately, the drug atezolizumab did not work for me. I am no longer in a clinical trial, but I am receiving a similar drug called pembrolizumab. Its trade name is Keytruda, and I am doing well on it after 24 treatments. Now I would like to briefly discuss genetic testing, as your healthcare provider may recommend that you have one or both of these tests. The terms that I will mention here are germline and somatic, as these are 2 test names you might hear and wonder about if genetic testing is advised. I had both germline and somatic testing. Germline mutations are inherited mistakes in the cells, and these mistakes will be in every cell in your body. Somatic mutations are mistakes that have been acquired in the cells over time. Germline testing results can be either positive, negative, or what is called a variant of unknown significance, meaning that they don't have enough information to determine its significance. I had genetic testing for somatic changes done by a company called Foundation One. The germline testing was a blood test, and the somatic testing was done on a biopsy. This is how both are usually performed. So that's it for now. I will end here, and if you have any questions, please let me know in the comment section below. Thank you for watching, and if you have enjoyed this video, please give it a like and subscribe, which will help this channel grow. And you will get a notification when another video is uploaded. See you all again soon.